people's attention and thinking about employment and education, especially the supported employment and education aspects when we're working with people in first episode psychosis. So just real briefly, the importance of work and school, really diving into what are those guiding principles and what does that really mean when we're talking about how we can help individuals with their goals for employment or education. And spending some time on disclosure, because this is something that I think gets challenging at times, and we don't always think about the continuum and the thoughts for disclosure. So real briefly, when we're talking about people who experience severe mental illness, more than 2/3 say that they want to work, yet less than 20% are actually working, and that's part-time or full-time. And then when we get into those who have access to evidence-based employment services, it's around 2%. So these are some areas that we really want to make sure that we're focusing on when we have these opportunities to really help people move through the pieces. Hopefully a no-brainer to everybody here. Most people do want to work. It's typical in our society that people work. And work really is recovery. So when we think about the negative effects of unemployment, regardless of whether you have mental health issues or not, we see increases in substance use issues, increases in physical problems, increases in psychiatric issues, reduced self-esteem, definitely loss with social contacts, alienation, and apathy. Whereas those who have steady competitive employment obviously have income. We were talking about income a couple minutes ago. Self-esteem, they build those social networks, and that can also help with quality of life and just feeling better about where things are going. People actually have better control of their symptoms, reduce their substance use issues, as well as have reduced mental health service needs because, again, their symptoms are more in control. They're experiencing better quality of life, and they're building those social contacts outside of then the more formal service-based contacts. So sometimes people will say, well, but work is so stressful. And we like to say, compared to what? So I love this quote, Gary Bund, I had heard him say this a while back, and I try and use it whenever I can, from Joe Marone, who is an employment trainer. If you think work is stressful, try unemployment. The stresses associated with work have not been associated with increased rates in hospitalization or issues with symptoms. And so when we try and impose that thought on why we don't encourage people to work, we really need to kind of switch our thinking and really kind of recognize how work is helpful with stress and helpful with other aspects, rather than thinking that work would be stressful, even though our work can be stressful at times. So individual placement and support, IPS, is the supported employment and education model that's been kind of adapted for that first episode psychosis piece. And so really looking at the fact that supported employment and education focus on work and school based on the individual's goals. It's not our goals for the individual, it's their goals. And the other key component when we get to those guiding principles is that work is part of that treatment approach. And so the whole team really is coordinating with that supported employment or education aspect of what's going on. Hopefully these aren't new to people. Looking at those core principles of what constitutes supported employment and education, first being that zero exclusion policy. It's sometimes easy for us to say, well, they're homeless right now, so they can't work. As soon as they're stable in their housing, then we can start talking about work. Their symptoms aren't stable. They're using substances right now. As soon as X happens, then they'll be ready for us to then start talking about employment. What we've seen when you do employ the zero exclusion is actually people rise to the occasion. It's their goal. And if they start seeing, gee, when I'm hungover and I'm late for work, I lose my job. Maybe if I stop drinking during the work week, I can actually keep my job and keep moving forward. So again, for us to kind of think about this arbitrary readiness is really needs to be pulled out of that equation, really start looking at, what's going on for the individual. That integration of employment and treatment. And so when you're having your team meetings, yes, your supported employment person is going to be working directly with the individual. However, the entire team really needs to be involved with that. Employment specialist might recognize that the person's too tired in the morning and is starting to be late for work. So then the psychiatrist might talk about, well, we can change the time that they take their medication so they're not quite so groggy in the morning, and really having that integration so that everybody can really help the person be successful. Competitive jobs is the goal for supported employment. And it's really important, and when on the education side, that integrative piece, staying away from kind of workshop kind of approach or work readiness kinds of programs. A lot of people will say that that's not what they want to do, and so they don't engage in that. It also can start pigeonholing people into kind of that ill side as opposed to the well side, and really focusing on the competitive job side of it. That also gets to that rapid job search. And so again, if we kind of make people jump through a bunch of hoops and you have to do all these assessments and you have to prove to us that you can show up on time for your appointments, things like that, and then we'll start helping you. What supported employment really says is rapid job search. So within 30 days of identifying that goal, we want to make sure that we're really looking for the job. Job development is another piece that is critical when we're working with individuals. It really does help the person identify what kind of work they might be interested in and help them really kind of identify what those settings might look like or what the skill sets might look like, things like that. I challenge all of us to really think about, are we currently in the first job we ever got? And I'm seeing a lot of no's around the table. I'm seeing a couple of shaking of heads on the video. And so when we think about a forever job, that can be very unrealistic and can be very demoralizing, as opposed to if we think about, each job is a learning opportunity and will help the individual kind of decide maybe this is their forever job, or maybe there's aspects of this that now they understand they like or don't like. The time unlimited support does not stop when the person gets a job. In fact, that's when things kick into high gear. And those follow-along supports, really helping the individual be successful, is one of the key components to the supports that are available. Honoring client preferences, and we're going to be spending more time on this specifically when we're talking about disclosure, but also just in job type, in location, in coworkers and things like that. And then benefits planning, I have just a couple seconds that I want to kind of talk about with that. One of the key differences between the IPS model and what's thought of as traditional vocational rehabilitation, traditionally it's train then place. You go to this job readiness program, you sit through the interviewing classes, you have to show up dressed for, resume writing things, stuff like that. Whereas IPS is place then train. Let's find you a job, then we'll do whatever we need to do to help you learn that job and be successful in that job. Just real briefly, people like to have data sometimes, and so there's been 26 different randomized controlled trials internationally. So there's been, I think it was 12 or 13 were US and the others were international, and consistently all but the one in China have shown that the competitive employment rate for those in IPS versus the controls is almost double. And so again, when we look at the types of supports that can help people be successful in jobs and making sure that we're really helping people with those successes. And they stay in the jobs. So again, we're looking at anywhere from 5 to 12-year follow-up, and people have been employed at least half of the follow-up period. 49% who had IPS versus 11% were employed. So again, being able to keep those jobs. We heard people talking about benefits, and we know that we try and discourage people applying for Social Security disability. And part of that is really focusing on helping that individual achieve those employment goals or their educational goals. We do encourage that they make sure they're accessing healthcare coverage, including Medicaid, so that, again, they can continue forward. Not all jobs will have the health benefits, and so just making sure people have the benefits they need. And it's important to understand that when people do go on disability, they almost never fully support themselves through work. And so fewer than 3% who are awarded disability-based SSI or SSD ever stop those benefits and go 100% onto just work-based support, financial support. So it's important for us to really think about the implications and to think about if someone does need to have that for the income side, that we're working extra hard to have that be that temporary piece to really help people move forward and achieve their goals. So again, thinking about these core principles, disclosure is something that will come up across the board. And so this is something that I wanted us to be able to spend a little bit of time really talking about. Disclosure is really sharing information about your situation. So when we're talking about work or school, it's with those employers or with the educational institution. This really needs to be an informed choice. It's not just yes, no, I'm going to disclose or I'm not going to disclose. There's a full continuum of what to be disclosed, when to be disclosed, to whom to be disclosed, and making sure that we revisit those choices and those decisions about what and when to disclose, especially when people are facing job changes, facing struggles that they're experiencing either at school or work, if they're close to losing a job, if disclosing portions, asking for accommodations might help them be more successful. So really having that conversation about what is it that we want to disclose. We could get extremely specific. Deb is a woman who experiences schizoaffective disorder. Her medication makes her really tired in the morning, and so we're hoping that you can help her find a job that's going to be an afternoon shift. You know, she really doesn't do well when there's a lot of people asking her a lot of things, so if we can make sure that her job is more focused on things where she can be independent, you can get into a lot of information with an employer or with an educator. Could be that Deb has a mental health condition, could be just a chronic health condition, could be just that Deb takes medication, could be that she's working with an agency that just helps people with their work or school performance. There's a lot of different things, and you can see along the continuum different amounts of information that can even come across in that way. When it's school related, we've talked on previous echoes, but thinking about, some official registration with whatever the student services might be called, getting a formal letter of accommodation. Even if someone goes that formal route, they can still choose whether or not they're going to share that letter of accommodation for an individual class with an individual professor. May choose to do it at the beginning or wait until maybe they start noticing some problems. Some professors will even work with students who don't have that official registration or letter of accommodation, and some won't. So again, it's that discussion with the individual, really figuring out what's going to help them be most successful, figuring out what the options are for supports. We, as the first episode team, can provide those supports outside of the formal realm, or we can also then incorporate that into some of the more formal supports that might be available through work or school. In addition, needing to think about when to disclose. Is it during the job development, at the point of application, at the point of interview, after the job offer and the job's been accepted? Do you wait until you're experiencing some problems that might impact your performance? Do you wait until you need specific accommodations? So there's a lot of different points along the continuum. For those of you who are able to hear the Ellen Sachs talk, she was even talking about not disclosing at all unless there's a very specific gap in employment or perhaps a semester where grades just seem out of the ordinary for someone's typical performance. Other than that, she was even saying, she doesn't see the need to disclose. So there's a lot of opportunity to really kind of talk about pros and cons and really digging deep into what are the advantages and what are the disadvantages. Giving information for the sake of information is not going to be useful. We really need to challenge each other to think about the potential advantages and consequences of all the different things that might be disclosed, when and to whom. This might be an interesting team meeting conversation for you each to kind of come up with when are scenarios that it's better to disclose, when are scenarios that it's not better to disclose, what might be some of the consequences and challenges, and then having those conversations with the individual as well. And absolutely, once we've come to a conclusion that this is my choice right now, that we have to make sure that those choices are honored. Even if we've seen patterns in the past where we thought certain disclosure might have been useful if the individual is in a specific place, we have to make sure we honor that. And we can always revisit the conversation of the pros and cons, trying to develop discrepancy with the individual if they're still saying that they want a certain level or lack of disclosure, and you're thinking that maybe some disclosure might help in certain areas. And again, really having that conversation together about what might be some challenges, what might be some advantages. The choice to disclose doesn't mean that supported employment or supported education stops. There's a lot that we can still do, whether or not the work site or the educational site knows anything about what's going on for the individual. And so it's important that we pay attention to what are some of the needs, what are some of the skills, what are some of the strategies that we can help that individual to continue that support. And then again, revisiting those pros and cons to see if there's another opportunity. So in the context of honoring choice, I wanted to spend just a few minutes challenging you to think about unintended disclosure. Do you wear an ID badge when you're doing job development or you're visiting someone at a job site? So does your ID badge say that you work at XYZ Mental Health? The person said they don't want to disclose, or they don't want to disclose that they have a mental health issue. The business card, does it have the mental health agency on there? Your email address is at mentalhealth.org. Even the phone, when the person answers, they say, thank you for calling the mental health agency. How may I direct your call? So these are unintended areas of disclosure. However, it's things that we need to think about when we're doing the different supports that we'll be doing for the support employment and education. When you're doing job development, how do you introduce yourself and what your role is? So it's important to think about when you're first meeting an employer, come up with some more generic, more broad description of what you do. So when you have someone who doesn't want disclosure, you have that to fall back on, because it's hard to unring the bell, especially if you've done job development with a different person who had different disclosure preferences. And now you might be going back to that same employer because they have a job that you have someone to be interested in. Just some things to kind of think through. So definitely make sure your introductions start as broad as possible. You might also consider doing business as. And so organizations have actually created separate entities, if you will. And that's what appears on your business card. That's what appears on the ID badge. There's a separate phone number that gets answered with, Jobs Unlimited or whatever your DBA might be, and separate email addresses. So that can also help cushion that possibility of unintended disclosure. And again, just being aware when you're visiting a job site that you're not inadvertently disclosing. So I would just kind of throw it back to you, any ideas, thoughts, or questions you might have.